So just to give us an face, and there are no person on the screen, so it's more the intention to show you how big and multidisciplinary our team was. So we are a consortium by 12 members from different countries of Europe, more or less. All regions, southern, northern, middle Europe. We have an interdisciplinary team working together, technical partners, building the prototype and setting the device, the implementation. Then we have clinical partners for testing who are running the living labs as well as the pilots. We have 4 pathologies tested as reference sites. Here, the region of Lombardy in Italy, the Basque region, and the University Hospital in Bucharest, so from Romania, as the 3 reference sites with these 4 different pathologies which are tested. But now you have a more or less impression of the system. Let's dive a little bit deeper into the. Now it's again. I think you shouldn't switch the focus of the system. So let's start where. Okay, this is the slide I need. Sorry. This one? No, backward. So let's see how it runs. Okay, so where we start? What is the as-is situation which we use to motivate our project? Our motivation came from a situation which we find in nearly all European countries, or more or less worldwide, that we have a disconnection between the between the inpatient sector, the hospital care, and the outpatient ambulatory care, especially in the field of rehabilitation. So in Germany, I think we have a quite nice system with ambulatory rehabilitation, but this is something we don't find in other countries in Europe. So there is a disconnect between this episode you have in the hospital, then you have a contact to the physicians, and the physicians recommend you to do exercises, to change your lifestyle, to do trainings, to improve your conditions you have maybe after a stroke accident or a heart failure, and so on. So this is a situation where we start with WeCare, and what we're trying to do is to integrate the home environment to get a continuation of care. A continuation of care that we integrate the home environment and the daily living of the patient, so the ordinary life more or less of the patient, into the care setting by defining rehabilitation pathways which should be followed in the home setting, in the home environment. And as we know, this could be quite complicated if this is only these are only letters on paper. We follow the approach of software as a medicine, more or less, to implement a coach, a companion, who guides you and helps you during this period at home. Though this is the scenario we want to follow, and which was the motivation of the project, that our hypothesis was we can care better and the results for rehabilitation would be much more better, and the risk factors which might be lower when we have this coach who monitors the training, who monitoring vital signs, and which integrate this in one more or less comprehensive, holistic system. We will see where we end. I think there are a lot of lessons learned in the project which will be communicated during the day. But this was the overall mission and ambition, to make this experience to gain this experience for patients. I tried to put the overall pattern of the system in this one slide, where we say from the end, see it from the end. What is this? What we want to aim for the patient, what we focus for the patient, is to lower the risk factors of the patient, the nutrition, movement, also the background, the education to get the patient activated, as said in the presentation before. To increase by this the quality of life, to improve the adherence to the pathway at home, and more or less to foster the health promotion and the ability to take care of your own in your home setting. So it's very important to bring it very smoothly, the patient to the pathway, to keep him on track and to help him to perform activities. So those are the patterns in the middle. So we implement information about risk behavior. We try to lower this, of course. We try to motivate the patients, and we gave them special training, for instance, by serious games to support the mental health, or to support mobility by exercises, for instance, which we transport by this avatar. On the left side, you see the avatar, and the role of the avatar is to monitor the exercises, to monitor also the context, and try to personalize and to adapt the trainings to the condition of the patient. So this was one of the mission. We will see at the end where we end up. Of course, this is quite ambitious. As you know, when you personalize, you also personalize, more or less, interventions, medical interventions, and this automatically. And now you see already what could be an problem in this setting. So I speed a little bit up. One very short story from this slide, maybe to understand where we will be on for today. We are not a product. I think this is the main message of this slide. Our mission was to build a prototype and to test this prototype in the operational environment, and to gain in a small scale study first evidence on the implementation of virtual coaching in a real world setting. So this was the ambition and the mission of our project. Our mission was not to build a full-featured, stable prototype which can be plugged in every environment very smoothly. So you see also the three big stages of the project. We're running a tech lab, a living lab, and the pilot. But this will be something for later today, when Massimo present the overall study design and the results from the study. I don't run through each topic here. I just want to point out some specialities of our approach. So what is the different, or the so what question, and also some aspects which made it quite hard to implement the solution on a technical level, but also on the subject level, on the level of care, more or less. Our tool, or our vCare solution, has a clear clinical focus. So it's not a self-management app which allows you more or less to do very disconnected from a carer exercises and so on. So we have this clinical pathway in the focus, or rehabilitation pathway, which is prescribed by physician to the patient. We call this instantiation. So we have a template of a pathway. Then the doctor figures out what exercises has to be done with what level of intention and so on. And then he configures this rehabilitation pathway. And this is the baseline for the exercises during the interaction with the virtual coach. the next point is that we don't focus on one single pathology. We said we build a generic backend where you can have a generic set of services, and you can configure this backend by these pathways, and then you can use this in different pathologies. And this was showcased by this Parkinson case in the Basque region, this heart case in the Romanian region, and last but not least, the stroke case in Milan. Yeah, as said, one element is the pathway we used. So we had a workshop with the physicians and specialists who are aware of the recommendations of the guidelines and who are usually help to do the ambulatory therapy or the ambulatory rehabilitation. And they build these pathways together with us. Okay. We integrate, this is something I would like to show on a special slide. We integrate contexts and contextualize our solution by integrating medical devices like blood pressure, step counter, and so on, which give very important data to contextualize the behavior of the avatar of the coach, and which gave important information to personalize the intervention. And I would say this, maybe just a brief lesson learned already. This is already one of the main points to gain as much and as evident data you can, and to contextualize this is, I would say, one of the hardest task in such kind of a project, because you have to see that sometimes the data is not valid and so on. So it's quite hard. So at the end, this is something I switch on. So we have a special slide. You can follow this in the slide repository. But last but not least, I would say also from the technical point of view, a quite important message. The WeCare system is, as I said, not a product, and it's also not a closed shop. It's not a closed product. We build an architecture with a communication layer which allowed to connect external applications to the systems. For instance, we have a project which is more or less similar, the eWall project, which has not this pathway capacity, but which has a quite nice UI, a user interface, who said, well, we would like to use your pathways for our product. Could we connect to this backbone? Do you have an open interface? And yes, this is realized by WeCare as a service, by a facade, which allow especially those scenarios, which help us to connect other solutions. So this is already the final slide. I hope I gave you some. I gave you some nice feeling about the WeCare and the mission and ambition of the WeCare when we start 5 years ago. What are the goals? And at the end, you will see over the day that there are a lot of lessons learned when you see how we implement this system. So what are the contributions by the project so far, which we hope to give you further insights today, is we gain evidence on a virtual coaching scenario in a small clinical trial. We show this for different pathologies and implement this already in different health systems with different rehabilitation patterns. And of course, we also build this technology block, and we show the technological feasibility of such kind of approach. Further lessons will be part of the agenda today, and I hopefully open the floor and the scene for WeCare and the mission. So thanks from my side, And as always, we are very keen if you can follow us on the different channels we promote. And